I know that you're the co-founder and CEO. So you and Antoine, your husband, you both co-founded Coeurway.
Yeah, absolutely. So before we co-founded that, maybe I can get a little bit into my story and
Absolutely.
then tell you about like when we met.
Yeah, absolutely.
And yeah, good. So yeah, I studied at University of Ottawa in human kinetics. So I was always motivated for taking care of the humans, taking care of health. Um, I thought that I would be a kinesiologist all my life, but then the entrepreneurship got me in. So I went to do like internship in Norway, where I finished my bachelor. I was actually at the Norwegian School of Sports Sciences with with the marketing side. So I enjoyed it so much. Then when I came back in Canada, I really wanted to do something different, something big, something like building a company. So that led me to FitCam. But before that led me to Antoine. Yeah, so that we met back home in Saguenay.
Okay.
We didn't know before that time.
Okay.
I was working in a gym and he was working out at that gym.
Okay. Yeah.
And it was just like a good friend that became a husband
Nice.
and a co-founder.
That's amazing. That's amazing. Wow. Yeah, because I think you're the first company that I interview or I speak with that you and your husband co-founded the platform, right? So that's very cool. I mean, I think it brings just a different perspective to the game, you know. And I know that
Absolutely.
both of you have the kinesiology background, and Antoine, your husband, he dived into AI as well in the US, right?
Yeah, absolutely.
So when did this occur to you that, you know what, let me create an AI Scribe company? Why AI Scribe?
Yeah, that's a good question. Of course, we had the AI experience through FitCam that was looking to solve and was actually solving chronic pain. But what we see is an opportunity to really tackle a bigger problem, which is the paperwork in Canada. So we thought it was a more urgent need, a more local need as well, because we're Canadians. So it was nice to have the experience of the US business side because, we learned a lot through this experience. We learned about, everything related the IP, intellectual property, everything related to stock options for early employees. So these are the kind of things that we bring into Coeurway when we founded it, 2022. I have something to tell you. You're going to be one of the first to know. And since it's a podcast in English, it's going to be super pertinent. So, the name is Coeurway.
Yes.
Coeur, it means heart.
Yes.
In French.
Yeah.
Because we're people of like heart and we are in the sector of health.
Yes.
And the way, because we knew at that time that we were, creating something different, like a new way of doing things.
Yeah.
But it's French, right? So we know to expand like in other places in Canada
100%.
that we had to find another name. So are you ready?
Yeah.
For me to tell you this name?
Yeah.
Okay. Are you sure?
I'm ready. Yeah. Yes, I'm ready. Let's go. Maybe I should have a sip first.
So Coeurway is the French, and for the English, it's gonna be Coeurway because we care and we're in the healthcare, and it's just all stay in the same brand spirit as well.
Okay. I mean, well, you heard it here first. That's amazing. That's amazing. Like care. So it's in CARE, Careway. And it sounds the same, right? Depending on how good you are in, French pronunciation, which unfortunately I'm not there yet, but that's another conversation. But Coeurway, that's amazing. It's a slight change of branding there, right? Because I mean, it's still the same. It sounds the same. And the platform, nothing changes about the platform. It's just a name. Did your clients have a hard time pronouncing the name and so on? What inspired you? Because before you explained that, I was about to ask, like, Coeurway, where did that come from? But you just clarified. But what made you guys to switch to add like an English name to it?
Because, at first, when we founded with the name Coeurway, we really thought that Coeur was an international name. So we were like, yeah, it's bilingual and every English-speaking person knows about Coeur, but actually they don't. And that's okay. We had to find another solution. So that's when we, as you mentioned, people didn't pronounce it very well or didn't know like COEU. How do I spell it,
Okay.
So yeah, we did the switch for those.
Okay, and you wanted to make it simple, simple enough for. I think that's sometimes very important for branding, right? That's
Absolutely.
yeah.
Absolutely.
So you left from FitCam, and that's when you and Antoine, you said, hey, let's try to solve this problem in healthcare with administrative burden. So for anyone
Mm-hmm.
who doesn't really know what we're talking about here, what is Coeurway and what problem are you solving? And
Yes. So the problem with solving is administrative paperwork. There is a study that was published talking in Ontario saying that more than 70% of primary care providers report feelings burnout due to an increase in the amount of paperwork they have to do. The administrative burden, it's really a big problem we are currently living now. So it's really that we're solving. And the best way we found to solve this, to facilitate really the profession, the practice in healthcare, is through AI. So we use AI. Actually, it's a platform that listens to the conversation between the doctor and its patient. And after that, there's a translation of that conversation, word to word. And from that transcript, what we can do with AI is that we use this information, we reclassify them to make a good and ready medical note. So with that medical note, the doctor can take it and put it in his EHR.
so I have to ask, you're one of the first Quebec-based AI scribe, right? Because I know I've seen a few in the market now, and we don't need to get into that. But I know last year or the year before, when I was talking to your team at the time, there weren't that many AI scribes from Quebec in the market, which that got me excited because I'm like, if I'm going to look into any product for my clients, I'd like to see what we're doing at home. And so in terms of when you went live with Coeurway, can you give me an idea? Was it last year or the year before? When did you first launch your product?
We launched a couple of different iterations, starting with the alpha platform in 2023, after almost a year of R&D. So we launched it first with the nurses and doctors. We got a lot of feedbacks, and then it allowed us to launch the beta version. And the beta version allow us to then really launch the GA, so the general availability, in June 2024. So that's really like I would say the real commercialized version of Coeurway. So yeah, it was a big time for the little hearts, like I like to call my team.
Yeah. Okay. Amazing. I mean, it's like we said before that you co-founded the product with your husband. 'Cause if a physician, without having to listen to the rest of this podcast, they might be wondering, okay, it's cute. It's a couple, husband and wife, they're working on this project together. It could be interesting at the same time, but what would you tell a physician who is looking for an AI scribe out there? Why should they choose your product? And I always like to get this out early for, physicians who are just looking to understand that, so we're talking about Coeurway. If a physician is asking, why should I go with Coeurway? What would you say to them?
Yes. So before I answer that, I'll just go back to your first question about the dynamic between the husband and wife and everything.
Yes.
So it's important to understand is that me and Antoine are both health professionals. So we are not technical person. We did not code the platform. So we really early on got into a technical co-founder. That was really important to us to build the app and make sure the app was scalable. The app was secure as well, because what is more intimate than a conversation with your doctor?
Yes. That's right.
So it's one of the more intimate conversation an AI can have access to. So security was always at heart into our business, into the development of the platform. So what I would say to a doctor wanting to use AI Scribe, first I would say do it, because it really helps for the burnout and your balance in between your personal and professional life. I would say choose something that's really safe and secure for you, for your patients, because it's so sensitive information that it's non-negotiable for me. Also, I would choose something that really integrates into your workflow. So something that's easy of use, like Coeurway, for example.
Yeah.
If I may.
Yeah, yeah, absolutely.
Something that you just, it's easy. You press play, it works. You put that in your EHR, and you don't have to do anything fancy to make it work. And of course, you also want availability from the team that's providing you the technology. So that's something that's really important to us as well.
I've demoed the product. I've had physicians try it out, and they have. It's like you said. It really depends on the physician's workflow, and so and I say this often, but two physicians in the same specialty might not want to use the same AI scribe. It sometimes really comes down to the personal preference. So it's important for them to do the research. And when you look at what the CMQ or the Collège de Médecins, they put out an article last month talking about the best practices. So I always try to get all this information just to put it out there. I usually share it on my LinkedIn so that physicians or health professionals who are interested in using these products, they know exactly what their associations are saying. Because as we know, there are no solid regulations yet. But a big question that I usually get when I work with physicians is security. Because the Collège de Médecins says you have to make sure that your AI scribe is not using the patient data or the conversation to train its model. Where are the data centers, right? And how secured, what's the security protocol for these platforms? So what would you say to a physician who is saying, there's so many different platforms out there, AI scribes. And in terms of security, why should I use your product in Quebec? Like, are you abiding by the regulations or the recommendations by the CMQ or BPEDA or HIPAA?
Absolutely. So what's important is to understand is that in AI, as you said before, the regulations are not really clear yet. We are still learning through that. So that's why Coeurway was always obsessed with security and how can I be secure, but even more secure than that, what the market is asking, because there's obviously the TGV in Quebec. That's from the MSSS certification. So we are into this process, and even them are adjusting. We are still adjusting because at first they used to do it for the EHR, for, other health techs, but AI, it's new for them as well.
Yeah.
So we are kind of learning through that process together.
Amazing. So because you mentioned TGV, and I like for physicians or clinicians who don't know what the TGV does in terms of certifying platforms in Quebec, do you want to, just explain what TGV certification means to you guys, to AI Coeurway, or to a physician looking for an AI scribe? When they see TGV certified, what does that mean?
Yeah. So it's TGV. It's full of regulations that you have to respect concerning data confidentiality, data encryption, everything regarding the way it's treated in terms of where are your database. So it's important that these databases are not based in the US. They have to be based in Canada, Quebec. There's also a lot of things regarding the partners, because when you want to partner, you absolutely have to partner with someone else that has the TGV certification, because that ensures the data are in the highest standards of security. It's really touch everything about confidentiality, security, transfer, and everything. And I want to add something, because you talk about data in terms of AI, and what is important to understand about Coeurway is that when we don't need the data anymore, we destroy them. So there's no I keep it to make my AI better. Models are so powerful these days, and I don't need your data and I don't want your data. I just want you to have the best medical notes that you can have so you can save time and have more human practice, really.
Amazing. So in other words, in terms of TGV, operating in Quebec, it's very important to have TGV. I've seen platforms that operate here and they don't have, but it's just more credibility and also ensuring the Quebec users that, we've gone that extra mile to ensure that we comply, province. I think that's extremely important. And
for the public.
Yeah, exactly.
For the public sector. Yeah.
That's right. So it's good because, there's now over 100 different AI scribes, So everyone is creating one, and it's like the new shiny toy in the market now. And you can't distinguish which one is as good or reputable or as abiding by the standards that these entities or government regulatory bodies are setting. So TGB, that's big, and I hope that you guys are able to go through that certification process successfully. And you said you don't train your models using your patient conversation, and your data centers are mostly in Canada as well.
Absolutely. And in terms of also anonymization, while we do this AI process, all the data that's personal, it's removed from the context. So everything that's like your address, your name, and everything that could have been captured with the microphone and in the transcript is not taken into consideration at all.
So when the physician uses Coeurway, captures the conversation and transcribes it into a silk note, or if the physician can create a template. Talking about templates, that's a question that I get quite often.
Yeah.
Because this is a multi-layer question, but there's a lot of hallucination. It's like a personality of AI, right? That you try to
personality trait.
Yes, exactly. One of the personalities that is not right now. And one of the ways to avoid that as a user is to use templates. So in terms of Coeurway, do you have templates? Are physicians able to create their own specific 2 months checkup for a pediatrician, follow-up template or a headache template, maybe SAQ form? That's maybe probably going too far, but let's just keep it as templates.
Yes,
Are you able to do that?
We are able to do that. And before we launched the template builder, we actually launched something that's called that mode. So the health professional could choose the mode, which is like the fast mode and the reflective mode. What does this mean is that we had a lot of doctors saying that, the AI needs to take more, not diagnostic, but more initiative and talk more like a doctor, like if I would write it. But at first, to prevent the hallucination, as I told you, we were obsessed with security and hallucination. So we really put a cage around our AI to make sure that it had to be really something that was said and written that's in the note, right? But the doctor wanted more. So this is the fast mode that we had since the beginning. So that means, let's say you say, I have a knee pain. Then the AI would write knee pain, right? But what we launch is a new mode, which is the reflective mode. So that means the AI takes a little more initiative. So instead of saying knee pain, it will say gonalgie. I don't know if it's that in English, but in French, it's gonalgie. So it's like the more scientific medical word.
Yeah.
So
we kind of to understand what that is, but sorry, go ahead.
It's like the scientific word to say like a knee pain.
Okay, got it.
So we allow our AI to say, okay, let's remove this part of the cage, I guess, so you can take a little bit more initiative. And then, as you said, the template builder is also a good way for the health professional to have more personalization, because every practice is different. Like, yes, we have some standards that stays the same, but every professional wants the Scribe to be personalized to their need. Yeah. So we launched a template builder, which allow doctors to put the templates they want.
You mentioned, training your training modules and having the reflective module and so on. If you know how Dragon, the medical dictation software now owned by Microsoft, originally nuanced, physicians who would use that, the way the Dragon works is the more you use it, the better it learns. It's like you train your Dragon. So the more you use it, the better it understands exactly what you want the output to be. Without you having to correct over and over and over again. Is that a behavior that your tool has? Even though you don't really train the physician doesn't train the platform itself, the AI, but at the same time, I'm just curious if their experience is enhanced over time using.
So that's a really good question. I can see about Scribe.
A little bit,
right? I mean. So what we have to understand about platforms, technology like Dragon, it's dictation, right? So you see your patient, after the patient leaves, you dictate, okay, here is what happened in the consultation, here is what I prescribed, blah, blah, blah. And then it does something, right? What platform like Coeurway does, it's really ambient Scribe. So it's really during the conversation between the patient and the doctor, it's listened by the AI. And then where we can get a little more personalization for this specific conversation is at the end of when the patient leave the office. You can add dictation. So you can write it down or you can just speak it out. And it's gonna take into consideration this part and then merge it with the ambient Scribe. So it's kind of a smash of these two parts to make your notes. And it's funny because it's not like everybody that is aware that we have this functionality, but we do have it. So it's possible to really say, hey, I really want you to take into consideration, let's say, the nonverbal that I noticed during the conversation, or a diagnosis of, let's say, cancer, but I'm not comfortable to say it in front of my patient yet because I need to do some tests before. You know, like all sensitive stuff that like could not be listened during the conversation can be added during, like you can type during if you want, or after.
Yeah. You know, that's so interesting because you're saying that, and I'm thinking onboarding process to use an AI Scribe, it's fairly straightforward, you know, depending on the platform, but again, it's straightforward. It's very different from, you know, learning how to use an EMR or electronic medical records. And so I'm curious what are the questions that physicians ask you when it comes to onboarding? What do they struggle with? Because if you think about it, you're not a physician using an AI tool. Now they have to say, okay, so I'm doing the physical exam. So they have to change their habits, right? They have to change their habits in terms of the way they practice a little bit. So do you see physicians struggle with that? Is that a thing at all?
Well, that's something. Yeah, go.
Sorry, I was just gonna say, is that a thing that just slows down their adoption process, where they're like, you know what, now I have to. The patients think I'm weird saying all of these things out loud, where I didn't used to say it before. You know, so is my doctor losing it? You know, so. I'm just curious, in that adoption process or onboarding, do you notice that with your users?
Absolutely. So, well, in terms of change, that's something we were really sensible since the beginning. We did not want the doctor to change anything to their practice. So, no, we are not asking the doctor to say the physical exam out loud. That's why also we create the box I talked to you about that you can write down. So it's taken into consideration. And when you're at the phase to really generate the note, you generate the note that includes the physical exams, right? So yeah, the goal is really, and it's something we managed to do with some iteration and some frustrated doctors that just said, hey, I don't want to say that out loud, so I quit the platform. And but then they come back and they give us feedback and they come more like positive and like they want to help. So, but yeah, we went into these kind of problem.
Okay. And what's been the most challenging part of building a product like this? I don't think that you said it, but you and Antoine, the other co-founder, who's your husband, you are not AI engineers, for example, right? So it must have been quite the learning curve for you both prior to, right? And it's changing so fast, and you want to stay competitive and you want to provide absolute value to your users. So I'm just curious, like, is there any challenge that you've had so far that you're like, because of that, my approach to problem solving is different, or you question just being in this market?
That's a good question. Well, you mentioned it, like the learning curve of like, okay, I'm a kinesiologist, I'm a video creator at FitCam, and then I'm like an entrepreneur, like a founder. Well, we have to learn about finance, HR, and everything.
Yes.
So I used to say sky's the limit, but now that I'm more into like running the business, I'm more like, well, finance is the limit. Finance is the limit, and HR is the limit. You know, we only have like 24 hours in a day, and we need to sleep, eat, get with friends, and do our things. You know, we don't work all day. So it's really the big learning for me, and I'm being very vulnerable sharing that with you. At first, I was like this. I'm still ambitious, but I used to be like more ambitious and not really thinking about, do we have money, do we have people? I don't care, we just do it, and we do it now. So I think that my big learning these days, like, okay, if you want to do great things, sometimes you got to take your time and kind of plan. Even though it goes fast, we monitor all the new tools that we could add or modify into our platform in R&D to make sure we're ahead on the market and the more performant platform. Still, we're human and it's normal.
Yeah, no, absolutely. Absolutely. And I think, being the CEO at the same time is, it's a different ball game, right? Like you get to make all these decisions as to if you need to pivot or, whatever it is on the day to day, right? Yeah, but I think it's interesting the path that you choose, and it's the perfect time, right? And I know that only the companies, the AI Scribe companies that are producing or providing the most value are going to be the ones that are, going to stand the test of time. Because if you look at it, what I notice is other scribes or AI scribes are partnering up with the EMR companies and so on and so forth. And I have physicians ask me, okay, sure, I can copy paste the transcribed note into my EMR. That's just one click. It's fine. It's not the end of the world. But is there a possibility where I can have this integrated into an EMR? And, so that's really a question for you, where is that something that you're thinking about, if you're able to share? Um, or are you just worried about the EMRs building something like this for themselves and taking over? They already have most of the market share. Well, they have the market share. Their users are using their platform, right? So they can easily sell that or help solve that problem, and bring it to the market faster. So how are you approaching that, EMRs in that space and, partnerships as such?
Yes, absolutely. So EMR, EHRs are really the tool of predilection for health professionals, for doctors. So it's a no-brainer that we have to partner up with them. We started to do this high-level integration with the one available in Quebec so that a doctor doesn't have to make the copy-paste. In terms of EMR, I think the future is really about deep integration. It's about building AI that go beyond the scribe. So it's all these things you can think about that you don't need a medical degree to do. Well, the AI can support you doing it, or even better, do it for you. So it's really where the market is going, and it's really where Coeurway wants to go and is going as well. We have a massive announcement coming up in the next few weeks that's going to make this vision really possible. So stay tuned for that. I cannot obviously spoil it today, but it's coming up maximum 3rd of March.
Okay. Amazing. Well, I'm excited to see what that's going to be. I mean, because if you look at, like I said, I've spoken to quite a few AI Scribe co-founders too in Canada. Coeurway's biggest value prop, right? What's the biggest value that Coeurway brings to its users? Is it that you train your modules a lot with the, Quebecois French accent and, and so on. Is that one of the value props that you would say?
It's really important in Quebec and some part in Canada as well to really have a functional bilingual platform, because you don't want an AI scribe in French and an AI scribe in English, right? You want the same. So Coeurway works in both French, English, and a lot of other languages, but French is so hard to work with in technology. And that's one of the why that made me want to found Coeurway. It's we knew that technology would be really advanced, but in English only. So we were hey, why do we French people have to suffer and wait 1, 2, 3 years for nice technology that can actually have impacts in the health system? We'll do it. So was it hard? Yes, it was really hard. But did we do it? We did it. I mean, it's not me, it's the product team. They did it. So it's at that time, it seemed impossible. We were how are we going to do that? How are we going to make it possible, make it happen? But we did.
You did.
So yeah, it's one of the value prop, as well as the security that's really important to us. Not to brag, but I really think that we are kind of a tough leader in Quebec in terms of security in AI. We got mentioned from Microsoft and also Conseil de l'Innovation in AI in Quebec last year at PLS. So it's, PLS, like the
Yes.
event in
Yeah.
that
Premier
went in
Ligne
May.
Santé. Yeah. I think.
It's Première
Yeah.
Ligne en Santé. Yeah,
Yeah.
absolutely. So they see what we see in terms of security. We know that our public system is there, but it's like, I don't know how to articulate that. What I would say is that AI is new and we are all in this together. And I think that it's really through partnership and talking with the public system together to find a solution. So let's say, hey, you used to do these security standards, but now there's AI. So you have to consider this and this and this as well. So let's build together like a more responsible AI use.
Amazing. Going back to language, we're talking about how important it is, or how difficult it is to train the models on French, and in particular Quebec French, which is very valuable to people living in Quebec. One question that I usually get quite often from the physicians is that, yeah, sure, your platform can do both languages, but I don't want to have to think about switching the input and output language every single time, meaning that my patients would speak in English and would speak in English too, but at some point we switch the language in the same conversation, right?
Yeah.
Or a family member could be in the room that only speaks French and a son or daughter only speaks English. And so it makes it a little complex. So how is Coeurway solving that problem of just capturing whatever language, within limits has been used during the conversation and just transcribing the note into one, whether it's the final note is going to be in French or English, that's fine. But the conversational language, it might be multiple. Are you solving that problem?
Absolutely. It's happening in live. So let's say you're an English-speaking doctor that's using Coeurway, and then your patient starts to speak in French with his daughter or whatever, then you will see what they are talking about. So you can jump into the conversation and say, you're talking about this, and then you can really understand. So it really helps for the doctor. And it's not just French, it's also like other languages that you can think about. So it really helps for the communication with the patient. So it's not the goal of the platform, but it does that on the side as well.
So it's really like an auto detect feature that if you select that feature, then the option, then it just captures whatever conversation, and your final note would be in your language of preference, whether it's
Yeah, absolutely.
Okay.
Absolutely.
And in terms of patient context, I think last year, around January, same time last year, I was onboarding a physician, a different tool at the time. And they were talking about patient context, because you just mentioned the daughter being in the room with the dad. Is the AI tool really able to capture like the different conversations that are being had? Meaning if the patient came with two support, like the two of the kids, because that happens, right? And or someone translating on behalf of the patient and stuff. Is that something that Coeurway is able to do?
So let's say you're going into your doctor office and you're talking about your knee pains, diabetes, and something else. He is smart. Like he can differentiate. Okay, he's talking about the diabetes, talking about the knee pain. And my daughter is there, by the way. Can you prescribe the pill or something? Okay, yeah, the AI will be able to categorize for a different condition, different person. So that's something that we were not shocked, but like happily surprised. Like, oh, okay, that can do that. But we also had to put a layer on top of the AI to do that. So yeah,
Sure.
it's something that's important and possible.
Okay. So, because, I think you talk a lot about security and how you add layers to make sure that things are really, very secure. One thing that I hear a lot of people, it's standard. You have to get consent from the patient. There's no conversation about it. All these associations, whether it's the FMSQ or FMOQ or the CQ or CMA, they all say that, consent, explicit consent is good, especially if the models are being used the conversations are being used to train the models, which in your case is not really. But bottom line is get the patient consent. Now, this is a conversation I have quite often where when we onboard, when I onboard AI Scribe in a clinic, and we need to get the front desk involved in obtaining the consent. And just
Mhm.
solving that consent workflow can be a pain sometimes, where it's like the secretaries are hesitant to asking for the consent every single time, especially if they're using an EMR that is not pushing questionnaires or pre-visit forms, meaning that
Mhm.
you can create that consent in the EMR and send it to the patients beforehand. So then the secretaries are spending 5 to 7 minutes or sometimes less for the patients that they sign and they don't ask any questions. And to that I say, are we shifting, we're saving time with the physicians, but are we adding that time to the front desk? And if that's really the case, which I've seen, what are we doing about it? Are we going to, and by we, I'm asking, Coeurway, are you looking to address streamlining the consent, or you're leaving that to the EMR providers to be able to handle that? Technically, it would kind of make sense if they can, but is that something that Coeurway is working on?
That's a good angle that you're bringing, because the consent, it's also something that can be managed during the conversations. How Coeurway is built right now, it's more about, it's like per consultation, you need to obtain the consent. So it's really like something on the app that's like, yeah, I got the consent, but if you do not like activate this mode, like, yes, I got the consent, you just cannot use the app. And if we look at the study from Ontario MD,
Yes.
and also from what we've seen with our customers, from the acceptation rate of the patient of like using the Scribe AI is from 80 to 90%.
Yes.
So it doesn't happen often that sometimes people say no, but it's their right. They can say no if they're not like comfortable with it. For the clinics, what we think that helped is by just put an affiche, something that's written like, oh, my doctor used Scribe AI, and then that's how it works. And then we put cute little images. So then the person on the front desk can just say, hey, this is what we are using. Look at what it's written there. And then the patient can really understand what it is. That's another way to get explicit consent as well.
Okay. Okay. Yeah, no, that's good. But sometimes you have in a practice where there's 10 physicians, just one is using it. And so you have that problem of, okay, I guess my secretaries would have to add this additional time to their workflow just for this one physician, or is the physician going to do it themselves? But I agree, having signs in the waiting room is good. And sometimes what I see the physicians doing is they get the patients to sign themselves, So the patient comes in the room and they ask them, or the physicians who prefer to use the tool just for dictation, meaning that they only use it when the patient is out of the room. I'm guessing that that's a use case that you see with Coeurway, where the physician's like, I don't want to think about consent. That's too complicated. I'm just going to
Well,
make sure that your platform is secure, but I'm sure that's a use
Well, we
case you
did.
see.
Yeah, we did actually. When we launched the ambient scribe version and we launched the dictation version, and we only got one person taking the dictation version. So we actually thinking about discontinuing it because people are ready for the ambient.
Interesting.
Yeah.
That's interesting. I mean, 2 years ago, when I was having these conversations with physicians, they were very skeptical about using any AI in Scribe. But I guess now that it's more popular and everyone's talking about it, and that they're doing their due diligence, they're getting more comfortable. Because at the time, a lot of them would say, you know what, I wouldn't use it to record my patient conversation, but I would use it to just dictate, because for the ones that are already using Dragon, so it's just they're switching one platform to the other, but the AI brings something better. It's much more accurate, and you're not editing or proofreading a lot as compared to using Dragon.
Yeah.
Yeah. So one interesting thing that I've noticed is a workflow that I noticed is that you have some tools that it's the nurse assistant right? So some tools in the US that use, not so much in Quebec, but in the US that have a nurse assistant, meaning that you can send a questionnaire. How do I phrase this? You can ask the patients questions using your AI tool prior to their visit, right? So you send them a link and they're sitting from home and they're asking, all right, Marie, why are you going to see Dr. X today? And, explain. And they ask one question after the other, which is pre-programmed. Is that a workflow that you guys are looking into? Does that interest Coeurway?
Yeah, I cannot spoil all the R&D, but what I can say is that Coeurway now really takes care of the now, of the during the conversation, but everything that's before and everything that's after can really benefit from AI. And before you talk about like doctor that had resistance of AI, and I think that the way I see it is that we're not asking like to every doctor to use AI, and that's perfectly fine if they don't want to. But if work, like the burden of paperwork is like killing their passion, and I think they should really consider using a tool like that, or at least finding a solution for them to get like healthier practice and more human care, because it's solving a real problem that they are living. So I think the like how I would phrase it is that every doctor deserves an AI scribe, or deserve the AI scribe effect, no matter what the solution they want to.
Yeah. Okay, that's fair. I mean, I'm always eager to see what, talking about what your vision is for, so your vision for the next, months or years, and if you're able to share what users should be expecting, or an idea, are you going to focus more on partnerships, or you're going to be building more features, or just enhancing the features that you have, or exit? I don't think that's going to happen. Well, I hope not. But
And what people tell us, like our customer, they say that what used to take me before 15 to 20 minutes, now it takes me from 3 to 4 minutes. So it's huge, like the impact we have on their life. Some even say like we saved their life, like literally. Some even said we saved their relationship, like their couple.
Yeah.
So it's huge, the impact we're having.
Yeah, no, I think it's because different physicians, they use it for different purposes, right? So, every time I sign up with a new client, I usually ask them what problem they're trying to solve. Yes, it's a note-taking tool, but really, are you just trying to leave home on time, leave work on time or early, or you want to be able to see more patients, or you just want, or both, right?
That's the thing.
Yeah, or
you can do
quality,
both.
or do you just want better quality notes? Right? Like, because everyone complains you write on paper and they can't see your handwriting, or you write just 2 sentences and you want a better summary just for better patient care, right? Yeah. So in terms of those different use cases, I'm also curious to see what each physician that I work with, what their approach is. I don't know if you've come across or you've implemented Coeurway on a clinic-wide setting where you've seen physicians starting to see more patients, or they're in the path to seeing more patients. Because the truth is, this is a tool that really benefits the physicians the most, right? And that benefit, then you have the ripple effect that the clinic owners, or, they benefit from that if the physician gets to see more patients, which is not always the case. So I'm really curious if you've implemented Coeurway in any of the clinics that have, they're starting to see such benefits, or they're heading in that direction.
Absolutely. So on the private sector, it's really health clinic networks. So we do implementation for clinics. For example, we recently announced a partnership with Réseau Ma Clinique, which is a big clinic network in Quebec.
Yeah.
So when we onboard our customer, we ask them like, how many times do you spend into like doing paperwork? And we also do it like while they use the app, we do like a calculation to see how many times, like how much time they save using the platform. And it's about like 10 hours a week that they saved like using the platform. So that's for the private sector. For the public sector, we are doing right now like actively project, like pilot project with CIUS. So it's the hospitals in Quebec to prove the same thing, the same data. And when we look into the Ontario MD study that I talked to you about earlier, they say that Scribe AI save up to 70% of doctors' time. So that's a lot.
Yes.
In our pilot, we were more conservative.
Yeah.
So we said it's like 10%, but I'm pretty confident it's going to be way more than 10%. But it's what's written for the pilot. So really looking forward to have the public result for AI Scribe in Quebec. In Canada.
Yeah, I mean, because I've read the publication by Ontario MD. Try to follow them as much as possible. I mean, I think it's part of the expertise I bring to my clients is that I try to be current about what's going on in the market. Yeah, I saw they say 70%, and for pajama time, physicians who complete their notes at home, right? And they obviously don't want to do that, but they're so busy that that's probably their only option. And so if the pajama time has been cut by 3 hours, I think that's incredible. I think even 1 hour would have been, you just use that 1 hour to, I don't know, Netflix. You don't even need to be productive, just something to relax or if you want to spend more time with your patients, that's really up to you. But yeah, no, I think it's incredible what you guys are doing. And so tell me about support, right? So when physicians, when they have an issue, is Coeurway, do they have the support on standby? I think 24/7 is asking for a lot there, but what's your support like?
Yes. So I think you're not going to be surprised if I tell you we use AI in the support. But also humans. So it's a combination of both. So we have a chat that people can access 20 answer like we can with the AI, and when it reach a point where it needs to be like human touch, then we jump into the chat and get in relation with the customer.
That's good, because I was gonna say I'm so much for physicians or everyone using AI tools. Do your due diligence first, and I use a lot myself. But when I have an issue, I had to cancel some reservation through one of these booking sites. I think it was Expedia or something, and I started chatting and it was AI. I'm just like, I want to speak to someone. Just bring me an agent. I get it. I get what you're trying to do, but I just want to talk to someone. It's the same as when people call on the phone, they just press 0. Just put me through to an agent so I can yell at them or scream at them or just have them solve my problem. So it's good
of
that,
course. Yes, we also have that. Like people really, we kind of notice that these days it's a lot of emailing. You get a lot of like email and everything, but someone calls you to say, hey, how are you? How is it going with the use of Coeurway? Like people like to be called these days because we receive so many emails and so many like other kind of communication that it became like a rare thing to get a phone call from a technology company saying like, hey, how are you? How is it going? Can I help you? And then people really like this as well, like cold call, I would say.
Do you still do that?
Yes, we do.
When a physician onboards or anyone you start using your product, you give them a call.
Yep, that's what the commercialization team does.
Oh, that's cool. That's really cool. And do you only focus on the healthcare space, or you have lawyers or other professionals interested in your product?
We really saw the opportunity, and we also had like demands from other markets. The thing is, we really want to focus on something, and that something is really in health, is really for doctors, and we won't stop until we're satisfied, if I could say, like of the quality, like the features, the integration with EHR. Like I feel like we just started. So I would not see myself saying, oh yeah, I'll make it available for lawyers for that. No. We focus on that track. We are bringing value into one focused market. So that's really where we're heading with Coeurway for now.
Okay. And in terms of markets, I guess for now, it's really you focus on the Quebec market, or you're expanding into the rest of Canada and the US? Do you have any US clients?
Absolutely. So we are in like the majority of the market share is in Quebec. We have some New Brunswick, also pilot going on like in discussion for in Ontario and other places in Canada as well. For the US, you gotta have to stay tuned for my big announcement coming up. It's a big announcement including Coeurway and another Canadian company.
Okay.
That is in the US. So that's the more I can say for now.
I try to ask these questions to try to get you to say it, but no, I won't. I won't push. And
I want to keep my job.
Yeah, no, absolutely, and I want for you guys to keep running the show, because you're a mom, right?
Yep.
And
Of two.
Two. Wow. Right. Yeah, it's so funny. I was deploying implementing client, and I called Antoine, your husband. He was on the way to drop off his kids, well, your kids, and
Were they crying?
No, they weren't.
Okay.
I don't know if he was using some AI that was blocking the background noise, but he told me he's just got to the parking lot of the school. And but he took my call, like he was trying to explain. I was explaining to him the difficulty we're having, and he sent me some quick screenshots of how to, and things that maybe weren't necessarily on your help FAQ or whatever just yet. It was really good. It was really good. So I got like that instant support. I mean, not every client of yours is gonna call you or call Antoine, but just in terms of balancing all of that. I mean, is there even such a thing as balancing, raising the kids and, just with the family and building a company like this?
Absolutely.
Because I don't necessarily believe that you can have that balance. I used to, but I think some things do suffer, So I don't know if that's your perspective when it comes to doing everything that you do. Running a startup where you're wearing a million hats. I mean, you're the CEO, but I'm sure that you're doing a million other things, and same as Anton, your co-founder. So what's your take on that? Like, how are you able to balance?
Let me bring you a little bit of hope, Yuzil. Because you said, like, I'm a CEO, I'm a mother of two, I managed to go at the gym still. I have two things for that. Like, first, delegate, and second, create a line. So the first is delegate. Like, as a CEO, I cannot do everything, like the support, the finance, the product. So I delegate, right? So that's how I managed to do my job as a CEO. And as a mom, it's the same thing. Like, I cannot do all the cleaning, the cooking, the daycare, everything. So I delegate. Like, I go and seek for help for taking care of the kids, doing the laundry, doing those stuff that I cannot do every day. And Antoine either. We do our best, but we're not superhuman, right? So delegate. And the second, I work with my husband. So we really had to create a line very early into our career, I would say, where you're talking with Marie, the CEO, your coworker, and then now you're talking with your wife and to the mother of your children, right?
Yeah.
So it's to create a line we are at a dinner, like a family dinner. We do not talk about work. We talk about family. It's we create a line. And same thing when we're at work, we do not talk about the kids. We're at work.
That's interesting. I mean, I think it's unique and refreshing to see. I think you're both blessed, or I want to say lucky, but I think it's more so blessed to have each other, to be able to understand each other and complement each other in terms of either just raising kids, but more so building a business like this, that it's so fast paced. Things are changing so fast, and decisions need to be made really quickly. You're a startup. That's all I need to say. So I'm building one of my own too. So but I'm alone, so I figure it out. But it's nice to see that you're able to, well, you're both able to pull that off. But if you look back through your whole process of building this, if you had to go back, it's such a typical question to ask, right? Like, if you had to go back, what would you say to your younger self? But really, if you had to go back to solve, no, but to solve a problem in the healthcare space, like would you still choose AI Scribe?
Definitely.
Yeah.
Definitely. That's something that matches so much like our vision that what healthcare should be, to be very vulnerable with you. The vision was like very like bigger than that. It was like, at first we wanted to have like a physical clinics and then laboratoire for Coeurway and then doing all the technological tools, not just AI Square, like everything, like facturation and everything. It was such a big like project, right? But too big. So then we decided to focus, like to say, hey, okay, what do you ultimately want to do and why do we exist? Well, we exist to facilitate the interaction between professional and their patient. We want their practice to be easier, to be more human. So let's just remove the keyboard and then use your voice for the consultation. So then you can really look into your patient's eyes and you don't have to do all the paperwork. So really focus on the mission, the why we exist, and then it just set the rest.
So, I know we're running out of time here, but I'm curious. It's a question that I like to ask any entrepreneur that I meet, because I'm new to the game relatively. It's been 2-3 years that I've been working on my business. I went full time on my consulting firm last year. So I know a little bit about the struggle, but I find that sometimes just talking about routines and building routines and so on and so forth to be able to help you achieve your business goals is important. But when I look at what my parents did, or the slightly older entrepreneurs in the game, they don't talk about that. You have a problem to fix, you just go ahead and fix it. It's not about trying to go to the gym or meditating and so on and so forth. But we live in a different day and age, right? So we have different tools to help us to cope. So I find that sometimes having a system that helps you stay focused, stay in line of what the vision is as to, just raising your kids or raising the business, because you have 3 kids basically, right? Right. So
Antoine is the fourth. Don't tell him I said that.
yes, I definitely won't. um, yeah. So did you find any system that you can adapt to just help you be able to whether it's going to the gym uh, every day or once a week or whatever it is, or you meditate? Because I'm always very, like I said, interested in how like entrepreneurs around me think and how they just approach their day to day.
Yeah. So in a startup, it's very like, it's weird because you have so much to do. Yes, we have a team, but still it feels like we are low staff because we have ambition, we have goals to get. So I think it's impossible to say like, yeah, we do like 40 hours a week. We have to do more. And so the system we got is like, I take 2 days, like 2 evening off. And Antoine takes 2 evening offs because we said like, why should we always be together, like the four of us for the routine with the kids in the evening? Like you can go get your me time and I can get my me time. And then on Friday and the weekends, we just all together. Right. So that's a system that really helps us get the balance between like, I need to do more hour at work and I still need to see my kids. So the kids are getting used to that routine. They know that Monday, it's just mom, Tuesday, it's just dad, and then so on. They're used to that. And then we can decide to say, I will go to the gym, I will go to a medical appointment, let's say like a massage or something, or I can work. Often of the time it's work and other stuff, but
Yes.
it
Yeah.
really helps with the balance, that system that we created.
Good for you guys. I think I love to hear, and it seems to be working. So keep at it. No, I think if you had to. So if someone's trying to get into the entrepreneur space in healthcare, right? You would say, you have your fair share of experience. Let's face it, we're all new to the game, but at the same time, we've learned a thing or two, right? And we're constantly learning, and a few days ago, I attended this conference at the HSC, at the Entrepreneurship School in Montreal. I don't remember what the acronym means, but I met this the former CEO of Cirque du Soleil,
Oh,
and so he talked a lot about just how to build a business and leadership and so on. And so I asked him, like, when you say leadership, like, how do you go about acquiring those leadership skills? And he told me, just if you're solving a problem, solve it really well. And when you put it out there in the market, people are going to see it, they're going to love it, and then they're going to come to you, and your peers are going to start coming to you for advice. And it just naturally happens. And at some point, and this I'm adding by myself, but at some point, if you notice that that's not something for you, if you don't really want to be the CEO, the one that makes the final decision, then you can step away from it. But it so seems that you really need to focus on the product that you're building or the service that you're providing, because the value is really where it's at. So for you, what would you say to someone who's trying to solve a problem or build a business around healthcare, whether it's AI or whatever it is, just what you've learned so far? What's one thing that you would say, like, hey, don't do that?
well, I'd say start early. Like when you know you have a good idea, start early to, get relationships, get people around your project, get help, like get support. There's so many like incubator, accelerator that you can go to and people that went through that. So it's really helpful. It was really helpful for me and it's still today. But most importantly, sometimes in healthcare, it can seem that it's not possible. So I would say follow your guts. Like if you know you have a good idea, you know how you know you have a good idea? It's when like it excites you, but it scares you at the same time. That means that's a good idea. You should do it. So I would say like take the leap and surround yourself with good people, like people that went through this to support you.
Yeah, no, I agree.
And
You know,
stay
just
true to yourself.
yeah,
That's important.
right. Yeah, that's a real one. And I always fail fast, right? But when I fail and some of the things that I do, I'm like, I know I say this, but it is so tough to bounce back. But you have no choice. You keep going, and for the most part, when you look back, you see the growth and so on. But again, I think it's a learning curve for all of us. I'm sure that decades from now, we're still gonna be having the same conversation because I'm sure, like you guys, I'm like to always learn and talk to people and understand how their mind works and how they solve problems and so on and so forth. So, but thank you very much for putting this time aside to meet me today.
Yeah,
Hopefully, when you and Antoine are in Montreal, I know you guys are out in Saguenay, but when you're here, we can have a beer or a cocktail. I don't know.
absolutely. And let me, if I may, like ask you a question because
Yeah.
it's interesting what you're saying about how do you solve problems. So I would like to know, like Uziel, how do you solve problem? How do you see that mechanism of solving a problem in the health tech industry?
It is a tough one just because healthcare it's find that it's difficult to have the adoption rate is usually slow, because it's so layered, right? It's healthcare. Like what's more private than healthcare. So I've worked in the space for more than a decade now. I'm on the different roles. I started an archivist, and then I moved my way to the IT manager. And now I opened my own consulting firm. Helping physicians finding the right clinical tools and so on. So I think it's a little bit like you said, in terms of just be true to yourself and finding a problem that makes sense, because you can spend a lot of time doing market analysis, and then you find yourself in that rabbit hole of analysis paralysis where and there's some aspect of fear to it, right? You don't want to take the leap to jump to it wasn't a very fun feeling for me to quit my full-time job with stable income to go and, cold turkey on my consulting. But it's something that I really, really had wanted to do for such a long time. And, talking to physicians and health professionals in the past couple of years, gave me the feeling that there's something here that I can expand on. And there's nothing better, all the things are better, but it's great when you solve a problem for, a physician or anyone, and that's excitement or the happiness that, the satisfaction that they get, that drives me so much, and, even going back to the fail fast, I just think I've had, I'm sure you guys have had the same thing where on your vision board, you have so many ideas that you've written down. And one thing that resonated so much with me is just how Netflix, they founded a company where it was just, here's an idea, how fast and cheap can we test this out? And that's something that has really stuck with me. So if I have any idea, I try to, first of all, I write it down, I let it sit
Good
because
start.
sometimes you can get too excited, right? Yeah, and you look back at it, you're like, that was crazy. Like, why would you even think of that? And then there's some that I have a project that I'm working on, like to try to get a product and so on, but not really in the AI space. But I think that, well, that's my process. I write down my ideas, and then eventually I get back to it. But when I get back to it, it's okay, how fast can I try this out? And I also have mentors around me. Some of my business partners, yeah, they have mentored me because they've been in the game for, decades. So they're like, that's stupid. Like, stop wasting your time on that. And I tend to be stubborn too, so when they tell me don't do that, I actually run and do it. And I find out the hard way. But as time goes by and you mature, a little bit, you start to pick the projects that you want to work on and so on. Yeah, I tell all my friends who are also getting into this space of entrepreneurship that, just don't try to overanalyze, like, sure, have some money saved up and so on. If you're going to go cold turkey, but like, just try as much as possible to test out your idea the fastest and cheapest way possible, and that's what I do. Yeah. But no one really asked me
Amazing.
this question, so I can go on for for hours. But yeah, no, it's
That's interesting.
yeah,
Over a beer
absolutely.
in Montreal.
Yes, then I'm more philosophical. Yeah, but yeah, no, thanks again. So if anyone wants to know more about Coeurway or sign up, or maybe you have a blog or a newsletter, how can they find you? And definitely I'll leave your links, your LinkedIn and so on, and my show notes. But how else can they find Coeurway? Or maybe they're just interested in knowing Marie and Antoine's journey building this company. So how did they find you?
Well, you can find us on LinkedIn. So Coeurway or Coeurway on Facebook. You can also write me directly on LinkedIn, Marie Lavoie. And yeah, Coeurway.com.
Amazing. Yeah, I noticed one of the videos that you guys put out where it was you interviewing your team, right? And it's nice to see that. And I was just gonna say you guys should do more of that. People
Yeah,
get to see the behind the scenes and who put faces on the product too. Which is
absolutely.
partially what I'm doing here. I like the physicians to know that products like yours exist and
Mhm.
they can make their informed decision. And so, again, thank you. And I'm sure that we would be talking soon.
Thank you very much. I really enjoy doing this podcast with you, Uziel, and I got to learn more about you as well. So really looking forward to meet when we go to Montreal.